Good day, everyone. This is TM on the podcast Purposeful Tribe. Today we are having a very important topic. But before we go into that, I would like to introduce the person, my guest today. That's the person of Liz. Good morning, Liz.
Good morning, Temidiri. Thanks very much for inviting us to your podcast. Thank you.
Okay, yeah. So, like I said, today's topic we'll be looking at sexual health as it relates to teenagers. So, for you, what does sexual health mean, and how does it concern our teenagers?
So, sexual health, really, it's the ability for women, men to enjoy and express their sexuality, free from unwanted pregnancies, free from sexually transmitted infections, free from coercion, violence, discrimination. So teens really need to be prepared regarding the sexual health, and they can do this by getting the information. They need to be prepared. So the information they need is to know about contraception, to know about how to use condoms correctly, to know about consent, and to have a discussion with a partner as well about sex, and to realise that if they're not ready for it, not to have sex, and they can say no until they're ready. And it's getting tested for sexually transmitted infections as well. So it is a number of things that they've got to learn, and it's where to get that information from. So it's knowing where they can get this information from. Importantly as well, for sexual health, it's knowing about unprotected sex.
Right.
And what is unprotected sex? So people they might not used a condom, or they did use a condom and it split, or maybe they were late taking pills. So they really need to have all that information. And emergency contraception, I talk to a lot of young people who have probably had unprotected sex,
Right.
and for some reason they didn't get the emergency contraception. Some people think because they call it the morning after pill, they think they've only got 24 hours to get it. They've actually got 120 hours to get the emergency pill.
Right.
And it's free from sexual health services, Zone 5 to 19. It's free from the family doctor. And it's free from most chemists. But some chemists, unfortunately, they're going to be charging 30, 40, 50 pounds.
Right.
So it's really important that people know the time limits for it. The best method of emergency contraception is the copper coil. It's the gold standard, and the emergency coil can be fitted up to 5 days after a woman has ovulated, and it can be fitted up to 5 days after the unprotected sex. So it's really important, people, and it's not just young people that don't know this, it's adults.
Absolutely, because I was going to come to that.
And if adults haven't got that information, they need to be supporting young people, giving them the advice. So everybody needs to know this information.
That's massive. Yeah. Talking about everybody needs to know about information. Why do you think it's difficult for teenagers, especially now? Though you've mentioned, and some people don't know, that we have a lot of adults that don't actually know how to relate with their sexual health. How they don't have a full grasp of what the sexual health is, how they should be able to help themselves. But prior to talking about that, what do you think could be responsible for teenagers to not be comfortable to talk about their sexual health or their sex life?
Why are they not comfortable?
Yeah.
I think at this young age, they're changing, their bodies are changing, their feelings, their emotions, and they haven't got all the tools, they haven't got all the information. So that's going to be difficult. So it's getting information from adults, trusted adults who know about contraception, sexual health, getting the right information. They struggle, they might find it awkward, they might feel embarrassed, but it's trying to get over this and realising that once you have talked to somebody who has that information, that is good, that is useful, that is really going to help them to have the right information.
That's fine. So talking about having access to the right information is also very key to know the right person to talk to.
Yep, absolutely.
Because we have some people, for some teenagers, the knowledge about sex, or about their bodies, they got to know it maybe from a friend, maybe at school, that doesn't even understand what the person is actually doing.
We come across this, yeah. Say their friends are learning as well,
Right.
so they don't have all the right information. This is why they need to come to a service such as a sexual health service,
Okay.
or go on to trusted websites as well for their information as well.
Okay.
Because otherwise they're going to be really misinformed. Because with emergency contraception, they might have a friend that says, oh, I think it's 24 hours that you need it, and they're just getting misinformation, when they could be accessing within 120 hours to get that the emergency contraception.
Okay, that's fine. Thank you. So, like we said, what we're talking about is important for teenagers to know the right place to get the right information from, and they can get that from your team.
Yep.
From the Zone 5 to 19 team.
Yeah.
And also, not only for teenagers, like I said, parents also, they need the right information. They need
Yep.
to know how to assess it, because sometimes people say ignorance is a killer, but sometimes it's not that the information is unavailable, but people don't know the right place.
Yeah.
So channel their strengths to contact. But it's fine that people can actually come to your team and have access to the right people, the right information at the right time, so they don't
Absolutely.
get victim or become a victim of what they should be aware of. Thank you very much about that. So talking about people having access to the right information, another key thing is people of females, either teenagers or even adults, having unprepared sex now,
Yeah.
right?
Unprotected
Or maybe
sex, yeah.
unprotected, unprepared pregnancy. Some call it unwanted, but it's actually not unwanted, because before you go into this,
Unplanned pregnancy,
it should be
yeah.
unplanned
Yeah.
pregnancy. So can you touch on that, please?
Yes, certainly. Unplanned pregnancy, especially in a teen, it requires important decision making. See, for an adult, it can be difficult, but for a young person, it's quite difficult. And people's responses to getting pregnant are quite different. Some people might be delighted, other people might be shocked, worried, anxious, and if a young person has got a parent or carer that they can talk to about this and support them, this is ideal. But some young people don't have that, so they might feel quite isolated, anxious, because they haven't got people to talk to. And then it's making the decision. Some people actually might turn to a friend, but at the end of the day, it's the person's decision, not the friend's decision. The friends might have some opinions, but it's the young person that's got to make this big decision. Okay. Outcomes for unplanned pregnancy are, one, people can either continue with the pregnancy and keep the baby, or they might decide to continue with the pregnancy and maybe place the baby for adoption. And
Right.
the other choice is termination of pregnancy. So Zone 5 to 19, we aim to support young people, give them the information, give them the time to make these decisions, and support them the best way and make appropriate referrals whatever the young person decides to do. So we could either refer to the midwifery hub, so they get that expert, see the midwife, or, we can refer to for a termination of pregnancy, which is Mary Stopes International.
Thank you. That's huge. But also, talking about unprepared, unplanned pregnancy for teenagers, sometimes it could bring about stigmatization for some people, and they may feel, like you said, they may feel not comfortable having got the pregnancy. So some may get withdrawn from the people that should help them.
Yeah, they'll feel quite isolated. Yeah.
Right. Yeah. So for teenagers watching us, it will be important, and even for their parents as well, it will be important for them to let their teenagers know, or the people around them understand, that if it happens, it's not the end of life.
Absolutely.
So, and
yeah.
it's something they can get help from people around them from zone 5 to 19.
Absolutely.
Yeah.
If they come and see us and we can support them.
Right.
Yeah. Yeah,
Thank you.
absolutely. And then the other things to consider, if somebody has an unplanned pregnancy, sometimes things can go wrong. People can have a miscarriage, or they could have an ectopic pregnancy. So it's just being mindful of that as well. Also, regarding sexual health, people need to be free not only from unplanned pregnancies, but it's sexually transmitted infection. So it's important people get tested and know where to get tested and know when to get tested. And then the other things that need to be free from is free from coercion.
Right.
So if people, if someone's being pressurised to have sex and they don't feel ready for it, but they're feeling pressured, they need to be free from coercion, or like people being offered rewards in return for sexual favours, things like that. That's coercion. They also need to be free from discrimination. So discrimination, sexual harassment, that could be in the form of maybe homophobia, biphobia, transphobia, and then free from violence as well regarding sexual health. So sexual violence is used to describe any kind of unwanted sexual activity. So that could be sexual abuse, it could be rape, sexual assault and sexual harassment. So that's what sexual health means, to be free from those.
Thank you. So before we go to consent, you mentioned transphobia.
Yes.
So what is the meaning of transphobia? Can you please explain that further?
Transphobia. So when a man is wanting to transition to be a woman, or a woman's wanting to transition to male,
right,
because they're minority groups, sometimes they get discriminated against.
right.
So they can come here to zone 5 to 19.
Okay.
It can discuss, they can get support in, can link up with organisations just to support them.
Okay, that's fine. Thank you very much for clarifying that. So let's talk about our consent, and why is it important for teenagers to understand that as it relates to their sexuality?
It's about giving permission for something to happen, or an agreement to do something, and nobody has the right to make you go further than what you want to do. Okay, and you have the right to say no at any time. So the video clip, it's a YouTube video clip, and it's Tea and Consent by Thames Valley Police. Wow. And if you're struggling with consent, this is really good. So just imagine, instead of initiating sex, you are going to make them a cup of tea. And this video clip is really, really useful for young people to watch. So it would be quite good for you to have it. In a relationship, communication, honesty and respect is crucial in a relationship. And when young people are in a partnership, it's really important that they're checking in with one another, that they agree and set boundaries and they talk about it. Young people just in a relationship really need to talk to one another about the sexual health, because it's a two-way thing. They both need to talk. And they need to put boundaries in. What are they happy to do and what are they not happy to do? And to be aware that these boundaries might change. What people are willing to do might change. So, and it's checking in with a partner, are they still happy with this? So it's having that communication. So it's really important in a relationship.
That's good. Thank you. So we spoke about social media, influence of social media the other time. So can you touch upon on how social media is actually impacting, possibly putting people, on the teenagers especially, under pressure, to putting them under pressure as regards sex or something else that they wouldn't have possibly given their consent to? And before we do that, let's look at, you mentioned parents having open relationship with their teens.
Yeah,
is very, very, very key, because sometimes I have
judged or ridiculed, they might go along with something. But sometimes if parents are quite open, they've got an open relationship with parents, that can really support that young person, that they feel free to go and talk to a trusted adult. But sometimes young people do feel pressure by others, by peers, to do things that they know is wrong, or taking a risk. Discussions, they might not want to do it with younger siblings there, so maybe if something's cropped up at the meal table, maybe to discuss it later with the older, the young person. But regarding social media, so young people, they're just exposed to so much these days, and it's remembering that everything's really heavily photoshopped, which sometimes can lead to negative feelings about people's bodies, and also if some people are watching, sexual content, because they did a survey that in the lockdown there was out of 14-year-olds, 24% were watching sexual content. So young people aren't always aware of how this actually impacts on them and the effect. So sometimes it might be sexualizing women, or expecting things maybe that they've seen on I don't know, porn, if they've been watching porn, and maybe having an expectation that that's what... A survey showed that young people believed that viewing pornographic content could make people less respectful to their partners. And then there was another survey by the Royal Society for Public Health, and they found that social media can produce a compare and despair attitude, and people get these negative feelings about their bodies or feeling insecure, and it can lead to low self-esteem and lots of issues around that. And as I say, these photos, these videos, they're just heavily photoshopped, so they're not in the real world, they're not really realistic.
Thank you. So let's look at, you mentioned the table time, the meal time, being the right time for parents that are very, very busy to have open conversation, open relationship with their teens and their children. But also, in the recent time, you see that meal time is another time for parents, for either as you're eating with one and they are checking the phone, checking either Facebook or Snapchat or WhatsApp, or checking, let me catch up on this. So I think that parents should be very careful. The meal time, like you have mentioned, should be a good time to have more relationship with their children, as against using that same time to be checking phones, using that same time to be flipping through Facebook, Snapchat, and thinking that they are actually helping themselves of the things they've not been able to check while they were at work. But they should give that time to their children and possibly to their spouse also, right? So that I just want to...
I totally agree, Timidri. When people are having the meal around the table, in my mind, that was quality time. So phones maybe in another room are switched off, and it's just focusing on who sat at that table.
Okay, so don't you think some teenagers may not be comfortable to either go to their GPs or to some places that they can actually access information, because they may think that their confidentiality may not be kept the right way?
Yeah, I hear what you're saying, yes. Quite a number of people might feel comfortable about going to the GPs, but usually when youngsters go to the GP, sometimes they might have relatives, might be working there, might be on reception. Some relatives might be patients there themselves. So young people sometimes are a bit anxious about doing that because this might just get back to the parent from a relative saying, oh, I saw your son, daughter there,
Right.
what were they wanting? So when people come here to Zone 5 to 19, it is private.
That's good.
And importantly, when a young person comes here, we always inform them that this is confidential, which means it's private to them. And sometimes we encourage them to come with somebody because it's nice to have support. So they might come with a parent, a carer, a sibling, a partner or a friend. But we always tend to get the young person in on their own first of all, because they may have something really private that they want to tell us that stays private. And then if they want the support of who they've come with, then they can come into the consultation room then if they want to, but otherwise it is private.
And even if their parents possibly give a call to your team,
Yes.
to know about what their ward or the children is possibly maybe going through, it's still meant to be private to the teenagers and not to be disclosed.
Yes, if we get a parent phoning about their son, daughter, then because it's private, we can't say that young person has been here because it's private to them.
What a teenager is going through, maybe they've been conceiving the idea of maybe based on their, maybe they were bullied at school, or maybe someone like stigmatized at school, or maybe by their peers, and they are considering, maybe some may consider suicide or self-harm,
Yes.
and they come to you. Do you think such kind of information should be shared with their parents to know how to also support them at home?
Yes. When we come to mental health, we
Right.
can offer support. So we find out what is the issue, and then we might, depending what level it is, it might be we refer to the school nurses,
Right.
and they will have some input at school, or it might be that this needs a referral within child adolescent mental health services. So in that case we would report to, which is called CAMS. Depending what it is, we would refer appropriately.
Right.
And then we'd strongly discuss with the young person. It would be beneficial to discuss this with your parents so that they know. But then again, sometimes some young people don't want to share some information to the parents, but we strongly encourage it. But if there was risk of harm, then
Right.
we would make appropriate referrals.
Thank you. So let's look at how young people can actually practice safe sex.
Yeah, it's really important this. They need to get all the information, because without information, they don't know. So where to get your information from? So sexual health services. There are some really good websites as well. So there's Brook, and then there's the NHS sexual health choices, but they can look on there, because quite a few young people do the research before they come in and see us, and then we can discuss it.
Right.
Others don't, which is fine, because we can give them all that information. So it's getting the right information. It's ensuring that they know about effective methods of contraception, and all about the different types of contraception. It's being knowledgeable about emergency contraception and the time frames and where to get that from. It's also knowing about condoms, different types of condoms, where to get them from, how to use them correctly, checking them after use, and what to do if they split. Do they understand about consent? And have they been able to talk to a partner about having, sex? Do they know what sex is? Do they know the different types of sex? It's also important to know about sort of like red flags and keeping themselves safe as well.
Right.
If they're meeting up with somebody, do the parents know where they are? Do they know where they're meeting up? And if they're going to parties, at those parties, are they similar ages to them, or are the other youths quite much older? Is there a responsible person at the party checking that everything's all right? So those are all part of safe practices.
Thank you very much. So that also emphasizes or underscores the fact that parents should, it goes back to parents and to your team also. The parents should be open to make their young persons comfortable, open to them.
Yes.
Right. Then you mentioned something around red flags.
Yes.
So can we touch point on red flags that our young persons should be aware of when they are in relationship?
Yeah.
Right. So.
Yeah, absolutely. So red flags, this could mean somebody, if somebody is stopping them and saying, I don't want you to have contraception, don't want you to get emergency contraception. It could be not wanting to use condoms, maybe pressuring somebody to have sex. You've got to ask, the young person needs to ask themselves, if I'm being pressured into having sex, is this the right relationship for me? Because that's quite a controlling relationships. It's awareness. If people are being given alcohol or drugs, this isn't, this is going to lower their inhibitions, and then they're going to do things that they're going to regret later. And then if people are also given alcohol and drugs, there might be a payback time in the future. So like in the future, I've given you all this, you're going to owe me X, Y, Z. And if they haven't got the money for it, then might want to be paid back in other ways, sort of thing. Yeah, so red flags, there's quite a lot.
Right.
Timmy Deary. So it's like being pressured to have sex by a partner. And sometimes it might not even be a partner. If a group of youth are out together and maybe some friends are saying, if say somebody's asked for sex, the friends might say, oh, go on, go on, go on. And they just feel pressured. And so sometimes they might just give and think, oh, and have sex and then regret it later. But it's been pressured. It's not been consensual. It's been pressured. They've given in. Being forced into doing something that you don't really want to do, that's a red flag. Being told what to wear, being given drugs and alcohol, being given money, being given a mobile phone. These are all things you're thinking, well, why is this young person being given this? Maybe the young person might be stopped, prevented from going and getting contraception, or if they've had unprotected sex, they might be prevented from getting emergency contraception. These are all red flags. Sometimes youths come a lot of pressure about the word sexting, where they might be asked to do semi-naked images or videos, texts of them nude. And if they send this, receive it or store it, this is illegal under the age of 18. So if young people tell us this, it's about getting it off the internet as well, blocking it. So if they, I think I mentioned earlier about the child exploitation online protection, they go on there, they can report this and hopefully some of it can be taken down, but if people have copied it, it's just out there forever. And then it's the fallout from that, how it's going to affect the mental health after something like that. Some people might be taken to areas for sexual parties, or pressure to have sex with other friends. Another one is maybe lying or misinforming people about their age, maybe saying they're a lot younger or older. Male and females can do this. And male to male, not using condoms or not using lube. Okay, or when somebody's having sex, they might have a condom off, but they might just try and pull it off before they ejaculate. So it's putting the partner at risk. So not accessing services, being prevented for getting tested for sexually transmitted infections, or in some cases where a partner might be have been informed they've got a sexually transmitted infection and they come in for treatment, but the partner doesn't.
Right.
And then after they've had the treatment and the partner's still not been treated and is refusing to get treatment, then, this is a big red flag.
Absolutely. Absolutely.
So it's young people being aware of these red flags and looking after themselves and thinking, right, is this the right relationship for me?
That's fine. Thank you. So when that happens, it's very important that the young persons then not keep quiet in such kind of relationship. One thing is to understand that these are red flags, but we've seen situations where people feel like, okay, these are red flags, but they are not talking it. They are not like voicing out. They are not seeking help. Possibly because they don't know where to seek help. But it's fine that people watching us now can understand that they can actually come to Zone 5 to 19 to see, okay, I'm going through this, and I can get help from here. And I'm going through this, and when I go approach this team, I'm safe with them. Yeah, that's very important.
Yeah, the importance of when a young person comes to us, has a consultation with us, it's confidential, it's private. And as a nurse, that young person is going to feel quite anxious seeing us. So it's our job to put them at ease and explain exactly what we're going to discuss, the questions that we ask. Because without that, it's a mystery. They don't know when they're coming through that door, what's going to happen. So we really want to put people at their ease. But we always sort of have a stipulation that if a young person tells us that they have been in the past or are at risk of harm, or they know somebody else who is at risk of harm, we have a duty to refer that appropriately, and we give them the appropriate support. So if something has happened to them in the past, we recognise what support needs to happen, and then we'll signpost for the more support.
Right.
And it's ongoing. When they leave the consultation, we do give ongoing support.
See, some of the signs you've mentioned, they should understand that those are red flags in the relationship. So they should be able to consider, is this kind of relationship I want to go into? Mm-hmm. Is this what? But sometimes it doesn't just happen. Mm-hmm. The person that are putting them under pressure or that are showing those red flags may not start immediately. Mm-hmm. Those predictors may not start immediately, right?
Yeah.
They may start off very, very good,
yeah.
but they have their own intentions. So,
absolutely.
But as soon as somebody may be good to you, but as soon as you begin to see some of this person was always very helpful before, but now he or she is saying this. These are red flags. You shouldn't close your eyes to those red flags.
No.
Seek help from Zone 5 to 19, and they always there to help. That's when thank you. So what do you think would be ways for young persons to have healthy relationships?
So really, the big thing is about talking to a partner and being open, getting that consent, knowing what the boundaries are, what you're comfortable with, and it's not being forced into doing things that you don't want to do. And teens, they're just developing their identity, and being able to openly discuss relationships in a safe environment is necessary for their self to develop. And having peers and adults as role models is really helpful to develop mutual respect in relationships. And being able to recognise any power imbalances is really important in relationships. So if they're cropping up, you're aware of them. Because if you don't know about them, you're not going to pick up on it. But if you've got an awareness and, an open relationship, talking to trusted adults, hopefully that's going to rub off and they're going to be aware of these things and discuss that with the parent or the carer and say, this happened the other day, and feel a bit uncomfortable. So then the parent can talk about that and give advice. So they've got an awareness of what's going in that relationship.
Oh, thank you. Yeah, you mentioned something very, very, very striking, and I need to quickly touch upon that before you go. Yeah, you talking about teens, young people having good role models that they can actually look up to. Is that correct?
Sorry to say that. Role models.
Yeah. Sometimes we've seen maybe possibly in a sport or in some other fix where young persons that are building their career, they're building future, or maybe in tennis, or maybe in gymnastics, and their coaches, they are meant to be embodiments of respect and leadership, possibly either molesting or harassing them, and possibly they feel that this person is the one training me, building me up to be the kind of person I want to be, and because of that they keep quiet. So for such people in the UK, they are relating with maybe with their coaches, helping them with maybe gymnastics, or maybe in any kind of field they have, and they feel entitled to those people. They feel like they owe this person helping them to achieve their career, and because of that they bottle up. They can't voice out, because they feel if I speak out, this person might withdraw the help I've been receiving from him or her. So what can they do in case such we find that people in this category, they are receiving help, coaching, and they feel if they speak out, such people might withdraw the help from them?
If we have a young person that comes to clinic and starts telling us that they have been abused in various ways, then we would definitely refer that we would be doing something about that. We wouldn't ignore it. We would have to respond to that and have a discussion with the young person and say that, what's been happening is wrong, and get the right support in for that young person. Might not be what they want to hear, because they're anxious about what you've just said about this other but it's wrong, and something has to be done, so that has to be stopped.
That's fantastic. So it doesn't matter how much help they are getting from somebody, as long as the person is not helping their sexual health, or possibly as long as the person is doing things that are either abusing or harassing them, speak out. Seek help.
Absolutely.
Don't feel entitled. Don't feel indebted because someone is helping you. Don't feel like, if I speak out, or don't take it as a norm. Because sometimes they can say, okay, this is the norm in this field. Is a norm in this particular area. You will be used before you get used. So thank you very much. Let's look at how sexual activity can impact young people's and even also adult mental health. How can sexual activity actually impact on the mental health?
So teenage sex, pregnancy, sexually transmitted infection, these are the main factors often that get highlighted within emotional and mental health. Young people, they might know how to avoid getting pregnant or how to avoid getting a sexually transmitted infection, but they don't usually understand the emotional impact sometimes that comes with that. And they may get embarrassed that maybe friends might find out and they might be talking about them, so that affects the self-esteem. Many young people might admit to, if they've had sex at a young age, they might regret it afterwards, and then if they're in a relationship and then the relationship ends, they might regret having been sexually active, and that might be devastated that the partner that they had might be seeing somebody else, doesn't like them anymore. So this then can have an impact on them. So some might get quite down. It could lead to maybe loss of confidence, reduced self-esteem. Some might even get a bit depressed, apprehension. Some might, as a result, might self-harm, and then sometimes some people might think of suicide as a result of a breakup. So when we do see young people in clinic, if there is any mental health issues, because we always ask a question about, we take a medical history, And so we ask about any depression, anxiety, and then we respond if a young person discloses that.
That's good. Thank you. So let's talk about emotional challenges that teens might face when talking about or when relating with the sexual activity or sexual health.
So sometimes young people might experience maybe guilt, shame. Some people might feel elated. Young people, sometimes they're grappling with self-esteem, or they fear sort of judgment, especially from peers, or ridicule, or judgment from the family. Young people, they're likely to face a range of health and social challenges. So, for instance, initiation of sexual activity while they lack adequate knowledge. This is massive. So if they're trying, wanting to initiate sex and they've got this lack of knowledge, so many things can go wrong.
Right.
So it's being prepared. So it's being prepared is key. Young people, this is a time of change when they're more susceptible to external influences that ultimately determine adolescent sexuality. And the most influential environments like the family, the peers, peer relationships, school.
You mentioned like people getting judged by their families. I think that is the most dangerous aspect of it, because you're the people that they should rely on, people that they can actually fall back on. If your friend bullies you at school, or maybe from among your peers, you can actually run back home to somebody that can give you support, someone that you can find solace in. But if the traumatization, or if the judgment is actually coming from your family, it can actually be very, very damaging to someone's mental health or their emotional health. So what I'm saying is that families should be a support system as against being judges of these things. So when they go through stuff, families, both the peers, maybe their siblings or their parents, it's not a time to start casting stones. It's a time to show love to the young people and tell them, you can trust me. If somebody from outside, from your peers, have bullied you, or they've done something to you that you're not happy about, you can trust me.
Yeah, but unfortunately, not every young person has that, which is very, very difficult. But yes, definitely, parents need to be non-judgmental,
right,
and supportive, and find that time to find out what's going in that young person's life, and do this on a regular basis, so that they're there for support, and be open, so that young person can come and explain what's going off, what they're unhappy about, what they're anxious about, so that can be discussed. But unfortunately, not everybody has that.
Thank you, well done. so how can young people, how can they talk to trusted adults when they are going through emotional challenges? How can they do that?
A lot of young people, they find it awkward, they might be embarrassed talking to an adult, but the more they just try and talk about things like this, the easier it actually becomes. Maybe it's finding the right time to do it as well. Sometimes young people might initiate a talk with a parent by email or text message, maybe, just to get maybe a conversation going, and then maybe the parent can say, right, what did you mention? Let's have a talk about it, sort of thing. So it's really important that young people talk to somebody that they trust. Young people can obviously come to Zone 5 to 19 clinic and talk to us. We're private, we're confidential, it's free, we're non-judgmental, and nurses, we speak in a language that they will understand as well, not using medical words, terminology. As a service, it's holistic, so we discuss health and well-being, mental well-being, safety as part of the consultation, and we're just there to support them. And young people, they can attend clinic with any gender expression or identity, or what pronouns they wish to use. And as I say, staff, they're all used to being able to relate to young people and speaking at any level, to level that they understand. Also, it's really important to know that we do have an interpreting service as well.
Oh.
So if language is not going to be a barrier, because we can use an interpreting service.
That's lovely.
And one of my colleagues uses British Sign Language. So if somebody is hard of hearing or has no hearing, we have a colleague that can sign.
Yeah, let's talk about the common myths or misconception that teenagers or even adults, some adults do have the same thing that they do have about sex and sexual health, and how they can actually debunk them.
Yeah, okay. Well, some of the myths or misconceptions around it can be like a young person might think, can't get pregnant if the partner uses withdrawal method. Well, that's actually a method for getting pregnant because of pre-cum or pre-ejaculate. There's about 3 million sperm just in pre-ejaculate, so that needs to be debunked. Yeah. Contraception, another one they might say is contraception can cause infertility. Well, it can't. We wouldn't give contraception if it was going to cause infertility. What can happen with probably Depo-Provera is it can delay fertility by up to a year or maybe 18 months after the last injection. But then again, if people were to have unprotected sex after it had expired, then they could still get pregnant. But with Depo-Provera, it can just delay it. But with the others, the fertility, when they stop using the method of contraception, it comes back straight away as it was before they went on to the contraception. Another problem myth is some people might think that they can't get pregnant before they start having periods. But the thing is, who is to say when a young girl is actually going to start having her periods? So they could start at any time. The average age is about 12, 14. So people don't know when they're actually going to start the periods for the first time. So having sex before then, they could, get risk of, getting pregnant. Sometimes people might think they haven't got a sexually transmitted infection because they're not experiencing any symptoms, which is wrong, because most people who do have a sexually transmitted infection, they don't have any symptoms. So they really need to come to a sexual health clinic to get the right advice. Any queries they've got, please come here and have a discussion and look at reliable sources of information.
Thank you. So let's look at the common STIs that teenagers or young persons should be aware of. And I must also say that sometimes people believe that when someone is an adult, they know so many things. There are some adults that do not understand, that do not have these key things. So the information you're sharing would also help the adult. So how can both teens and adults understand or know the various STIs?
Right. So anybody having sexual intercourse can get a sexually transmitted infection. There are two groups that are at higher risk of getting a sexually transmitted infection. So they are men having sex with men and young people aged 15 to 24. Chlamydia is one of the most common sexually transmitted infections, and it's a bacterial infection, and it's treated with antibiotics. There are lots of other sexually transmitted infections, but as I say, most people who have a sexually transmitted infection don't know they've got them. So it's really important to get tested. So the key times to get tested are, if you're in a new relationship and it's a sexual relationship, to get tested at least 2 weeks after you've been sexually active with that person, because if it's done too soon it can get missed. So it needs to be 2 weeks after sex with a person. Another key time to get tested for sexually transmitted infections is if you're in a long-term relationship, just get tested about every 4 or 5 months. It's really important to get tested if you've just come out of a relationship. Always get tested. Other times people are tested is if they've been sexually assaulted. So then the young person or the adult will have gone to sexual assault referral centre.
Right.
And then we usually see them later for follow-up. Also, if somebody's actually got symptoms, which is unusual, but if they have got symptoms, that is another time to get tested. So what are the symptoms then in a female? So they would look like they might get bleeding after sex, or they might have pain when they have sex. They might have noticed that they've got a vaginal discharge, which might be yellow or green. They might have some lumps, blisters or sores in the genital area. So if they're experiencing any of that, then to come into clinic and get tested, and to abstain from sex really until we've got the results. With men, again, so, and also for females, if they're passing urine and it's stinging, that, that's another indication that they might have it's a symptom. For men, they might have pain in the testes, in the testicles. They might have lumps, blisters or sores. They might have a discharge from the penis. So any of that, just come in and get tested. The tests we do, we do them in clinic. We've also got what we call a drop box. So as people come into clinic,
Right.
next to reception, there's an area where there's some boxes that have samples, and the young person will fill out the information. It gives their information, name, date of birth, how they want contacting for the result, the mobile number or email, however they want the result, and then they go and do the test. And it's really important that for men, they've not passed urine for 1 hour before they do the test.
Right.
So it's a urine sample. So in there's a bottle. They just take it to the loo, do the sample. For females, it is a swab, and they just gently insert the swab up the vagina and just twist it around 10 times. And then there's a bottle that it goes in, and then we send that off to the laboratory, and they get the results however they've requested. It could be email, text message, phone call. It's however they want. And then they'll get the results in about 7 to 10 days' time. And what those tests I've just talked about look for is chlamydia and gonorrhea.
Right.
As a service, we also do blood tests. We can do a full assessment, and we can do bloods for HIV, syphilis, and if needed, if it was needed, hepatitis B and hepatitis C, bloodborne viruses. But yeah, it's so important that young people just get tested if they've got symptoms, which is rare. But if they're in a relationship, always get tested.
Okay, that's one thing. Thank you. Before we get to the next question, so are these text free, or
yes,
they're paid for?
Everything is free at Zone 5 to 19.
That's massive. That's very huge. Well done.
Yeah, they
Thank
get
you.
these tests. We do the tests here at Zone 5 to 19 in clinic, or they can do a drop box. But we've also got SH24. It's an online service, so the young people who are 16 and older can contact SH24, and they can send for a test. And that's another way of doing tests.
Oh, that's okay. Yeah, thank you very much, our Liz. So let's look at how parents can actually have an open and honest conversation with their teenagers and around their sexual health.
Well, it's really important that parents, carers, they're up to date, they've got some knowledge.
Right.
That's important, and that they're understanding of the young person, and importantly, they're non-judgmental. That's really important. And if the young person, if they feel embarrassed, just try and make it easier for them. Maybe talk generically. Give them examples of young people and contraception, sexual health. Don't put the focus on the individual young person, and tell them if they need to talk, if they've got any issues or worries, to come to them, and they're not going to be in trouble. That's what young people are probably anxious about, being in trouble. So it's being open with them and just putting them at ease and reassuring them.
Thank you. But thank you for that. But I'm also looking at the area whereby parents that are actually inexperienced, because we're talking about parents having open conversation, and as much as honest as possible, right?
Yes.
But the key thing could also be that some parents don't actually know the right thing to do.
Yeah.
They don't know how to actually support these children. So when that happens for inexperienced adults, so what happens?
That would be really ideal for them to say, I think we maybe should get you an appointment at Zone 5 to 19 clinic and come and have a chat with us.
Right.
And it's confidential. And also, there are some really good websites as well for parents to look at to get information, so that so they can have these discussions with young people. So there's a really good website called Brook, and then there's the NHS website for sexual health. But ideally, I think it would be good for the parent carer to bring the young person to clinic. Discuss with them about coming to clinic. Would that be all right with them? And booking an appointment.
Thank you. So let's look at how parents and families can be of support to their teenagers or the young persons around information around sex.
So it's important that if families can bring them to Zone 5 to 19 clinic for a chat, and to get information or just for a chat or an information leaflet, because this might help the young person access clinic in the future if they brought, so it breaks that barrier down. So that would be useful. And also that they don't need to be having sex to have a conversation about contraception and STIs and consent. You don't have to be doing that. It's just good to come in and get the advice so that they're prepared.
Yeah, thank you. So I need to quickly emphasize this. Some parents only take steps, or do I put it this way? Some parents they are reactive, they are reactionary in their nature.
Yes.
They are not proactive. They don't seek for help when they feel everything is going well. Like you mentioned, that parents can actually have a visit with their works. Carers can take their teenagers before they feel those teenagers need help. It's not when a teenager possibly gets on one pregnancy that you then start seeking for help, right? It's not when you start feeling that this girl or this boy is not behaving a particular way that you expect that you should seek for help. Take them as parents, carers, and guidance. Take people on excursion or take them on holidays. Absolutely, I believe or I feel they can actually take them down to Zone 5 to 19 to have a look around, have a tour around, have a meeting with your team, and they can get exposed to the right information before the time. So I feel that is very, very important.
Yeah, definitely. In schools, they'll be having throughout the years some degree of sex education by the schools, and the parents would be informed about this. They've probably got to give consent for that initially when they're quite young, but hopefully the families are getting this as the young person is getting older. So by the time a young person's coming to our service, hopefully parents are aware of our service, But when a young person's in a relationship or at the beginning of a relationship, hopefully this might alert a parent or a carer to think, they're in a relationship. There's some things that they really need to be knowing before anything does happen. So, to get that appointment booked at Zone 5 to 19 clinic and come in and see us so we can give this advice and support.
Right. Having talked about parents taking their children not only on holidays on one particular excursion, they can actually bring them down to Zone 5 to 19 to get to know about things before the time reaches. So, what signs should parents look out for when they are aware that their teenagers are sexually active?
Yeah, my thoughts are, rather than looking for signs that they are sexually active,
Right.
It's about having an open, honest conversation rather than looking for signs. Just have this open, honest conversation with the young person and, be quite open, encourage them to come to you with these issues. Ask, if they're thinking about having sex, wondering what sex is. If they're asking these questions, that's the time to sort of engage with them and talk about this. And if they're uncomfortable doing it, then saying, well, I think it'd be good to come, to clinic and talk about these things. So rather than the young person hiding it, that they are sexually active, it's good that the parent carer is going to be open and ask, just have a conversation about, sexual health.
Thank you. So the key thing is still coming back to carers, parents, and guardians having open and honest conversation with them.
Yeah.
And they shouldn't be such that when the teenagers are coming, they are not comfortable to rely on them. And like you said earlier, it's important that parents and carers guidance should not be judgmental. Sometimes maybe a young person might have done something that you're not actually happy about. It doesn't mean that because you're not happy with what that person is doing, then you cast the person away. That okay, go and do with your life what to which. Because if the person goes in a particular way that will bring shame or trouble to you, it's still your problem. So sometimes they may fall short of our expectations. I mean, parents, guidance, and carers now. What your teenagers may do may fall short of your expectation. Notwithstanding, I believe they should not cast them out. They should still be supportive so that
Absolutely.
they can trust them. And then, okay, so when you're telling them that, okay, I can bring you on to Zone 5 to 19, they can actually trust them that they are taking them to the right place.
Yeah, definitely.
Thank you. So, having talked about that, so let's look at what resources are available for teenagers, young persons regarding sexual health.
Yeah, there's some really good websites,
Right.
which I'll discuss, but there's the Zone 5 to 19 website, which is good to look at for information. We also do outreach in schools, colleges, so this is really useful. So it's a good time to meet young people, and when we usually do workshops, we have stands, and this is a time when young people come up and ask questions, and then we can our colleagues actually doing clinics in college as well, which is really good. They can also reach their school nurse, and the school nurse can arrange for us to see a young person, so they can reach us through a school nurse. There's the SH24 website as well, which is for 16 plus, and there's a website there with resources there, information, and just come in and see, come and see us in clinic, either drop in or book an appointment. And as I say, it's free, it's confidential, and we're non-judgmental.
So let's look at how can teens, young persons, talk freely to their parents or guardians or carers about their sexual health, even though what they want to talk about will make them uncomfortable.
Yeah, they do. They do feel quite awkward sometimes. Some might feel really embarrassed about it. But talking to a parent or carer, it can be hard, but getting help is so important. And if you've got the ability to talk to a trusted adult, that is really good. You're in a good place if you can do that. If you can talk to a parent or a carer, they're in a really good place. The adults in your life are probably going to feel really pleased, usually, that you're being open with them and you're not hiding anything, and that you've come to them and asked them. They'll respect that, and it's going to really support that young person, and they'll think it's really good that you brought up these conversations, and for the young person to let the parent know, yeah, I am anxious, and so it's up to the parent, the carer, to make them feel at ease, and as I probably said before, it's making it maybe generic, not focusing on the young person themselves, just
Right.
maybe referring to young people in general, might make them feel more comfortable. And once people start talking about the sexual health, once they've done it a couple of times, it should get easier.
Thank you. So I also say that there's some people in particular culture that this kind of conversation is an hard talk for them. They believe that it's not what you discuss with young persons. That if you talk about it, to them it feels like you are exposing them to it, as against educating them. So it is important that people from that cultural background, especially in Africa, should be open. Is an educating season of phase of their lives, and you can't deprive them of educating them. It's not like parenting is beyond just providing food, providing shelter for the teenagers in the young persons under your roof. It goes beyond that. It also cuts across talking about their cultural health, even though to you, to those kind of people, it may seem like kind of hard talk, but do the hard talk so that you don't go through hard times. So I believe, it's important.
It's helping the young person navigate through the teenage years, which are really difficult, they're quite turbulent. So it's, if you've got somebody that you can talk to, that you're close to, that'll be so beneficial. Definitely.
Yeah, I've seen situations whereby, maybe possibly online, whereby parents we actually shouting down on their teens that where did you get this information from, and that pushes the teenagers back. It pushes them back to their child.
Yeah.
They don't know what next daddy might say if I say this. Sometimes some are exposed to sex life, possibly through magazines, through porns and other stuff, maybe from their peers, but they will be having that feeling, if I get home and I talk to mom about it, what will she say? And based on what you said, it's important that parents and carers and guidance should be open, don't be judgmental. So, and that takes us to
can I just say here as well, Timothy, young people, when we see them, and if they're quite young and they're wanting contraception, we do an assessment, and if we decide, they can have the contraception, we always say this isn't a green light to have sex, but if they are, then it's going to protect them from an unplanned pregnancy, which is better. It's much better than having an unplanned pregnancy. But giving contraception is not a green light to then a young person to go and have sex.
Absolutely.
Yeah.
Yeah, I do agree with you. That's important. So, excuse me. So let's look at where can things actually go to have a confidential conversation. That because the one key thing, like you are aware and you've mentioned, is things not being able. I mean, young persons now not being able to be sure that the information I'm sharing will be safe, will be confidential. So where can they actually go to have confidential conversation about their sexual health?
They can certainly come to our service, Zone 5 to 19. It is private. It is totally confidential. There are limits to that confidentiality, because if a young person did tell us they were at risk of harm, or they knew somebody else was at risk of harm, we would have to share that part of the consultation. We wouldn't say why they were here, but we would have to share that they were at risk of harm. But otherwise, yeah, it's confidential, it's free, it's private. So I would recommend any young person to come to this service. And when we're actually seeing people, because they've not been here before, they're quite anxious. They've never seen the nurse before, but you know, we've been working with young people for years, and we quickly put them at ease. And you can see in front of you a person, they're quite anxious initially, then you see the shoulders go down and a relaxed expression on the face, and you can see that they're starting to relax, and then by the end of the consultation sometimes they're smiling because they're relieved. I think they realise they did the right thing coming in and getting the advice, and they're leaving with a plan of what to do, and that's it's, you know, supports them, and they feel much better with that.
Thank you very much. You're doing a very good job, Liz. So let's look at how can teens, young persons feel very positive about their own bodies, because for some people they are not confident about their bodies. They feel yeah. So how can they feel positive about their bodies?
Yeah. One thing is really important, if a young person could shift their focus on themselves, and instead of focusing on things that they think they don't like, they think's negative, to have a think about what they really like about their bodies.
Right.
And to remember that something that they might not like about their bodies, somebody else might love. So it's trying to just twist it and look at things in a different light. And there's no such thing as perfection, you know. And the fashion and the beauty industries over the years, they're quite at fault really, but now it's really good that they've got a responsibility to showcase different body shapes, sizes, ethnicities, disabilities, sexualities. So these industries, they have a huge impact on how young people feel about themselves, you know, how they're represented, because if they weren't doing this, then the young person might feel quite isolated, or they don't fit, so which can lead to increase their insecurities and reduce low self-esteem.
Right.
So it's good now that the fashion and beauty industry, they're showcasing different body shapes, etc. So that is really good. And beauty has obviously got many forms. A parent also should be mindful not to pass on their own insecurities to a young person. And one of the ways this can be prevented is by being careful of the language they might use when describing their own body or that of others that they might see around them. They might say something casually. So it's just being mindful of that.
That's fine, thank you. So that reminds me of a book written, I've forgotten the author now. I think the title is She. It's about the story of a particular young girl that the parents felt that like that her physique was not right to them. I'm reacting to what you said regarding parents complimenting the physique or the outlook of their words of their teenagers, not like saying, okay, your head is this way, and that's how it kills the self-esteem of such people. So for that lady, the parents was always like condemning the way she looks like, and she grew up believing that we always refer to her as she, instead of appreciating the kind of person she is. Do you understand? So everybody, like you said, everybody has his own uniqueness. So you are unique in the way you are. Your body structure is very good the way it is. Just try to see what you can do to look good for yourself, not actually thinking you are not good in yourself. And like someone said, like beauty is in the eyes of the beholder.
Yes.
So it's what you see. So if someone sees that has been ugly, you see yourself as the princess of the world, as the best thing happening in the world around you. So believe in yourself, and anywhere you go, so you're able to carry your shoulder, not
Absolutely.
like thinking
And your
like,
head
okay,
high.
Exactly.
Yeah.
Not thinking that someone said, okay, I look like a dog or I look like a monkey, and so you are hiding your face or everywhere. Yeah, it's important. Yeah. So let's look at what role does self-esteem play in making teenagers to have positive attitude towards their own lives and their sexual health.
Yeah. So young people who may have low confidence or low self-esteem, they might be less likely to talk to a parent or a carer about sexual health. They might not access sexual health services as well. So with not getting the information, that might put them more at risk of maybe sexually transmitted infection or unwanted pregnancies. If they have low self-esteem, it might lead to them making maybe unhealthy choices in relationships and sexual behaviours. They may be more likely to engage in risky sexual behaviours, such as having unprotected sex or multiple partners.
Thank you very much, our Liz. It's been an amazing time, eye-opening time on this our show today. I want to appreciate for what your team are doing and your time with us here. So can you just share with us your departing words for teenagers?
Thank you very much, Temidiri, for doing the podcast. It's really important. Your questions have really been insightful. They're really, really good. Just like to say if there's any young person out there who's got any issues with sexual health, please feel free to come here to Zone 5 to 19 clinic. We're based at the Flying Scotsman. We're up on the 3rd floor. Just come and see us. It's private, it is confidential, and we can give support. So I hope you contact us. And the contact number is 030 00 213 032, or you can find us on the Zone 5 to 19 website as well. So yeah, please come and see us. Thank you.
Thank you.